Of your 8:30 headlines. Now, 10,000 vulnerable residents based in the Eastern Cape have received a month's supply worth of free immune boosters from a local health company to fight COVID-19. The supplement was developed specifically for this community and is geared towards boosting immunity and protecting against infections such as the coronavirus. But to tell us more about this initiative, we're joined by CEO of Coyne Healthcare, Kervin Coyne. Mr. Coyne, a very good morning to you. Thanks for joining us. Welcome.
Morning, Simpiwe. Thank you for having me this morning.
Your company has developed an immune booster especially for a vulnerable community. Give us more details on this.
Yeah, so obviously we're aware of what's happening with Corona. And for us, looking at it as a healthcare company, we realize one of the major challenges, if not the major challenge in South Africa, is malnutrition. In order to have a healthy body and to defend yourself against infections like Corona, you have to have an immune system that can handle these types of situations. And if you're nutritionally deficient, you're going to be compromised. You're going to have a suboptimal immune response. And so this is first and foremost what we should be addressing. In a place like South Africa, we see the prevalence of basic nutritional deficiencies hugely. Vitamin D3 deficiency, is estimated. We see these different studies coming through. 1 in 3 South Africans. It's probably higher than that. Research done in tuberculosis patients demonstrated that up to 80% of them were vitamin D deficient. So these are basic vitamins and minerals that have to be addressed if we want to have a healthy immune response. And so we wanted to take the first steps in doing this, and we've created a supplement which covers some of the most basic nutritional deficiencies which South Africans will be suffering with in these vulnerable communities. So these are things like vitamin D3, zinc, selenium, magnesium, and vitamin C.
So what were the considerations for focusing on this community in the Eastern Cape?
Well, we're obviously as a company, we can only assist so many people at once. But the main thing was for us to get a voice out there and make people aware that they can take health into their own hands. Okay. Things like nutritional deficiencies, healthy nutrition, healthy lifestyle, better choices are things that we can take responsibility for right now. Everybody that's listening to this. So these 10,000 people were the first 10,000 people we wanted to help, and really the connection with the Eastern Cape is based on my family. My mother was living there with my father, and they were doing a lot of community work and feeding people. And my sister's taken over a role there where she's helping a vulnerable community. And so this is really the first recipients of this, and we would love to reach more people and get this out there so that we can start gathering more support for the project. It's philanthropic, but the intention is really to help as many people as possible and really get the news out there. These people are vulnerable, and what are we doing to address basic nutritional deficiency in South Africa? Because, if we look at things like, we look at the social distancing that's taking place, washing hands, sanitizing, wearing masks, that's really just slowing down the interaction of the virus. The reality is that everybody will be exposed to coronavirus. The idea that you can self-isolate yourself for the rest of your life and never be exposed to corona or the next virus or influenza. In South Africa, 11,000 people died of influenza last year. That's going to happen every year. So the first and foremost, what we need to be doing is addressing our immune system and our immune response. And if we have a strong immune system, we can face any type of infection with a much higher level of or ability to overcome the infection without it being fatal or immobilizing us or putting us into a hospital.
And Mr. Coyne, why do you think there should be a greater focus on the immune system during COVID-19 in particular?
Well, because, with a compromised immune system, you're going to land up in hospital. With a compromised immune system, you have a higher chance of the virus being fatal. So, the idea that you can prevent the virus from interacting with the virus for the rest of your life is naive. These ideas of social distancing were to slow the spread of the virus. The reality is you will be exposed to it. Millions of South Africans already have been exposed to it. Why haven't they become infected? Or why are they asymptomatic, or why haven't they been hospitalized, or why hasn't it led to fatality in all of these people? And the truth is that it's because they have an immune system that's able to handle it. So, this is first and foremost. We hear, the discussion around a vaccine. Sure, I mean, that's a potential. We know that that's still a long way away. We know that it's going to be expensive. And the truth is, a vaccine responds to an immune system. So your immune system creates antibodies based on the vaccine. If your immune system isn't working optimally, you're going to have a very weak response to that vaccine, which means it's probably not going to work or work optimally. So we need to be addressing our immune systems and overall health.
Okay, and having said that, do tell us about your specific supplement, Kervin. What does it contain, and why those specific vitamins and minerals?
Sorry, I lost you there for a second. I think the question was, what does the supplement contain?
Yeah. And why those specific vitamins and minerals?
Certainly. So deficiencies are broad-based, but we know in order to, the most basic and fundamental for your immune system are going to be vitamin D3. They're going to be zinc, selenium, and vitamin C. So this is what the supplement's made up of. And essentially we've made it as efficiently as possible and in line with what would be sufficient to correct basic deficiencies in these vitamins and minerals. These are things that can be addressed through the supplementation, and really it's taking an immediate effect. What people need to be doing, though, more broadly, and this is a message we want to get out there, is they need to be focusing on their nutrition. We need to have an immediate effect with the supplement because we're in a pandemic. But this is going to go on for our lifetimes unless we address it through better nutritional decisions, better lifestyle choices. I think something that's been absolutely frustrating for me is I don't think I've heard one message from the media or from experts telling people to go out and get some sunshine. Vitamin D, we get this through sunshine. One of the best things you could be doing for yourself during this time is being outside and getting healthy levels of sunshine. It's going to be a beautiful day in the Western Cape today, and yesterday I had the opportunity to get lots of sunshine, and I was grateful for that. But this is how we raise levels of vitamin D3. And guess what? It doesn't cost anybody anything to go outside for 30 minutes and get some healthy sunshine. So, these are things we need to be discussing openly and empowering people with this information so that they can look after themselves, not asking them necessarily to social distance themselves for the rest of their lives or waiting for a vaccine.
Sure.
Those things can assist and play a role, but absolutely we need to address our personal health first.
Sure. Is this a once-off venture, or do you have future plans for this immune booster?
Well, this is something we want to look at creating as an annual event and building on it so that we can gather more and more momentum. So a pre-winter campaign where we're able to address these basic nutritional deficiencies in people. Yeah. This will be the first 10,000, and our intention is to reach every South African. We can do this in time. We know that. We know the cost of this venture, and we know that with economies of scale, we can address 15 to 20 million people in South Africa each year. This is what we would say would be the vulnerable group. And that's at a cost base. If I look at some of the interventions and investments that they're talking about in South Africa, we can achieve this with an investment of around 250 to 350 million rand. That's a big number for a company like ours. But collectively, as South Africans, as governments, we can easily achieve this. So, I mean, when you consider how much was invested in different interventions, we're talking about a 500 billion rand relief fund. That was a number that I heard thrown out there. If we can address every South African's basic nutritional deficiencies for the immune system with a reasonable number, then why aren't we doing this? So we wanted to put a peg in the sand and get started. And we hope that this can encourage other people, companies, and government to start participating in this and having a more open discussion around it.
All right, Kervin, thank you so much for chatting to us on Morning Live. We appreciate your time.
Thank you so much, Simpiwe. Have a great day and a good day to all of your viewers, and get some sunshine.
Most definitely. Thanks for that, Kervin. That is the CEO of Coyne Healthcare, Kervin Coyne, and we've been speaking to him about their initiative that provides vulnerable South African communities with free immune boosters to help fight COVID-19. We'll have more in a moment.